I was referred a patient by a good friend of mine for a full arch case, and he's a carpenter, and he was suffering. His teeth were broken down, and he's a young guy. He's in his 40s, and you know, but he was ready to do something, and he was embarrassed, and he was in pain. So we went through and we did the surgery, and when we were done, he took one look at what we were able to put in there, and he just gave me the biggest hug. This big burly, carpenter, just gave me the biggest hug, and it was the most gratifying feeling in the world.
Welcome to the Comfort Dental Podcast. Get a peek behind the mask with real people and real conversations.
Okay, so today I couldn't be more excited that I get to be with Dr. Michael Vetowich out of Colorado, Comfort Dental. And you guys know this series, this podcast, is all about revealing the person behind the mask, the hero in the practice, and just a little bit more about them as a person, their philosophy, their perspective. So, Doctor, my first question for you is simply, why dentistry?
When it came time to choose a profession, I knew I had a very artistic aspect of my personality, and I thought that dentistry would be a very good way to express that and help people. I thought that dentistry would allow me to, design smiles, help alleviate suffering, all the things that go along with.
So is this something where, again, you're a musician in high school and college, and as you're thinking about what to double down on, right away in college, you realize dentistry, or did you have any detours prior?
My undergrad career was actually pretty eclectic. I took a lot of music classes, and I took a lot of English classes. My bachelor's degree would be in English and music performance, but I wanted to have that be more of a serious hobby than a career. And I was just looking for something to express that part of my personality, but yet provide a living for myself and my family.
Well, in terms of dentistry, it's very much obviously in the healthcare field. And I know lots of dentists that have considered maybe being the physician, really were into, biology and just the body, and were fascinated by that. Did you have any fascination with that ahead of time, or is that something that you discovered that you loved as you were pursuing?
Yeah, I
dentistry?
did. I found biochemistry very interesting because in those days, especially, I was a serious runner, and I found the whole energy cycle fascinating in that regard. So I think that just naturally, I had an affinity for the arts, but I also had the ability to pursue and understand the sciences. So I thought there should be a way for me to kind of merge the two.
Okay, so anytime someone tells me they're a runner, I have to know, what was the distance?
Oh gosh, um, I've done several marathons in my life. As a matter of fact, I realized a few months ago I'm 59. I'll be 60 much later this year, the end of December. But I realized I've run a marathon every adult decade of my life. So I am thinking I have to start training seriously again and get one in my 60s.
That's amazing. So were you a cross-country runner then in high school?
I ran track and cross country. Then, as I entered my 40s, I started to do Ironman triathlons. So I've done several Ironman triathlons as well.
Okay, so when patients show up, doctor, do they know this about you? Is there something on the wall that kind of shows, hey, I'm a musician. Hey, I'm a
No,
Iron Man.
no, I don't tend to. draw too much attention to myself in that regard.
Okay. I mean, because I know I was talking to one doctor, and he's got the short sleeve scrubs on, and he's showing the tats on his arm, and each
Mhm.
of them kind of has a story, and it's kind of a segue into like, this is a little bit about me.
Right,
Um,
right.
is there a certain way that you do either reveal or disclose, I don't know, some of your hobbies or passions kind of when you're in the op?
I like to think that I'm able to have, discussions with patients on multiple levels about just about anything. So I kind of just let them steer. If they being I'm near Boulder, which has a lot of athletes, and if somebody appears athletic or has a race T-shirt on or something like that, I'll bring it up in conversation.
Okay, so I want to know, you go through school. At one point, were you sure, like, okay, I definitely picked the right career. Dentistry, like, is for me.
Hmm. I'm not sure you ever know that for sure. Dentistry is very demanding. You don't go a day without somebody saying, "I hate being here," which if your self-esteem is fragile, there's a very class. Sorry. There's a very uh, small leap from "I hate the dentist" to "I hate you." So I think that uh, to be a dentist takes a lot of internal fortitude on a day-to-day basis.
So based off that response, it sounds like you've, um, meaning like you've had a, how am I trying to say this? In healthcare, um, a dentist friend of mine, we talk about this often, that as a healthcare provider, you're either staying sort of open and tender to the fact that you're wanting to be present with people and care. But then if the feedback from those people becomes consistently like, I don't know, they're misunderstanding you, they're being harsh, it could just take one really challenging feedback. And then next thing you know, you're kind of hardening up and you're putting more walls around you. But then that's making it so that it's actually more difficult to be present and to be caring. So there's this trade off. Am I going to be present? Uh, I don't want to say sensitive, but possibly vulnerable and get hurt. Um, but I'm with the patient, or am I going to kind of just harden up, go through the motions, and be a little bit more distant because I don't want to keep getting hurt? Um, how have you navigated that tension?
Well, I think at some point you just realize that there is a floor and a ceiling, and the floor there's a minimum amount of professionalism that you are obligated to maintain, and that's really important. Whether you're having a bad day, whether you like the patient or not, though you have to maintain that floor. Um, and I think that's where the quality of your work really lives, because when you can do that on a regular basis, then no matter what is happening around you, whatever chaos, whatever someone is saying, you know that you're doing your part to help society and alleviate suffering. And ultimately, that's the floor.
So it seems like maybe based off of your skills and proficiencies, that the actual clinical side, being chairside, the craft of dentistry maybe came easier to you. Is it the business side? Is it the people side that you've had to, really push yourself to?
Me. The business side is not natural for me. So yeah, the other part of it, talking to people, being personable, that part comes pretty easy to me.
Well, that's a gift to have both, to be able to be clinically excellent, at the same time be comfortable with the fact that you're dealing with humans that you don't know where they're coming from.
Yeah.
You don't know exactly why they're in pain or what they're saying, or they're saying something, but they mean something else.
Right.
And I know sometimes that can be a struggle. Now, in your dental journey, how early on did you find Comfort Dental?
He was 8 years into my career. I grew up in the Detroit area, went to University of Michigan, both undergrad and dental school, Go Blue.
That's a
Um,
great school.
and I was getting married, and my wife lived in Chicago. I lived in Michigan. We had a long distance relationship, and we decided that we wanted to try something new and different. And I was leafing through a trade magazine at work, and I came across Comfort Dental. I am an avid skier, and my wife had never been to Colorado, but I had. And I said, well, you want to take a look at this? And we contacted Comfort Dental. It was much smaller at the time. I came in 2000, so we're nearly as big as we are now. I think I'm like partner 18 or something, or something like that. So I'm very early in the whole partner hierarchy, I guess. And we came out and decided this was the right thing to do, and we got married. And 4 or 5 months later, we were moving across the country.
Now, from your perspective, having been in practice without Comfort Dental, what is something you feel like Comfort Dental does really well for patients?
We focus on Dr. Kushner in his lean and mean philosophy, kind of distills it down to things that are really, really vital to our patient population. How much is it going to cost? How long is it going to take? And is it going to hurt? And it sounds really simplistic, but that's what 90% of our patients are worried about the most.
Yeah. So right now, like if a patient's listening, and let's just say, a good amount of patients have some sort of either fear or some sort of dental anxiety, or just are not really sure about why maybe they've had a bad experience for dentistry. Um, like, what would you say to them about coming to your Comfort Dental practice?
But just say, listen, this can be uncomfortable. I'm not going to pretend that there aren't aspects of it that aren't. I'm just going to be as compassionate and as gentle as I can. And I'm going to do my best to be gentle and make sure that your time here isn't doesn't involve more suffering than possible.
So, in terms of like what a patient could experience or feel on their first visit, could you kind of walk me through like what that experience could look like?
Now, I think again it comes from the initial interview, which is a key cornerstone to our lean and mean philosophy is figuring out what they need, what they are interested in. And you can glean that information pretty quickly. Whether they're in pain, usually if they're in severe pain, they just want to be out. So you got to figure out, okay, what's the easiest, simplest way for me to get them out of pain? If they're interested in something more, you can steer the discussion that way. If, um, finances are a problem, it's very important to figure out what kind of budget limitations they have and reassure them that no matter what their budget is, that there's usually something we help.
Now, I know there's a strong, what is it, Medicare population, Medicaid, and you handle that well. If someone doesn't have Medicaid, what are the options you have to help them maybe be able to afford the treatment?
We have a discount plan called the Gold Plan that we routinely offer our patients. If they, for a nominal fee, decide to go with a Gold Plan, they're entitled to X-rays, exams, and a lot of preventative treatment, and a pretty significant discount on any other treatment that they might need. So that's generally where they're going from there.
When you're describing treatment, when you're describing even payment options, do you find that patients are ever kind of like, I don't know, shocked at the affordability of it, or shocked that, like, are they waiting to see what if there's some strings attached, or if there's something that's, not mentioned? Because, you know, I suspect patients often come to you as a second opinion, or maybe when they've tried getting into another practice and realize that, that practice is booked supposedly 2 weeks out or 2 months out and they can't get in. And, they come to you thinking, I don't know, maybe they're going to get the same treatment. Maybe it's going to, take a long time for them to be seen. Um, do you find that patients are often shocked or surprised at how well or how efficient you guys run?
I think they're surprised that we are very focused on not upselling anybody on anything. That we do all those things. In fact, I'm an expert in implant dentistry, so I can do all of those things. But um, we will give them the option to proceed at whatever level they want to, as far as affordability, and that includes not doing anything. If they're, this is what I can do, this is what I see, this is what I can do. It's up to you where you want to go from there.
Now, you mentioned implants as one of the areas of expertise. Are there any other procedures that you really enjoy doing or have a high proficiency of doing?
Hmm. Well, going implant dentistry, being a oral surgeon, or being in oral surgery, kind of goes along with that. So I would say those two aspects of dentistry become my focus, especially in the last 7 to 10 years.
Now, does that mean that you have some partners that are more just general, so that, like,
Yeah, my partner Jack Moss is, he's a general dentist, and he's very happy offering those services. And I've kind of evolved into what I do now, and I'm doing a lot of full arch dentistry, and I'm just taking it mainly because of my interest level in that type of dentistry, offering those things to my patients. And surprisingly, even though it is rather expensive at times, I've tried to offer that level of service to my patients in a lean and mean way. Meaning I'm trying to offer that in a way that's more affordable compared to other dentists that are offering that type of care.
this seems like this kind of goes back maybe to the artistry in you, where, you love the mastery of this instrument or this type of technique, or really going deep into it. Now, all of a sudden, it's like, it's not just general dentistry. You really wanted to go deep in implants.
Yeah.
Is that just part of your, like, intellectual curiosity, where it's like, man, I just want, there's something else I want to master, a new frontier?
Yeah. Yeah. I'm very much, uh, I recently read a book. I am very fond of the Renaissance and Leonardo da Vinci. There's a book I read not too long ago called the Vinci Curse, meaning that Da Vinci himself only finished a handful of paintings. And it's very, very easy for intellectual curiosity to lead to not intellectual, but uh, productivity paralysis, where, you
I
dabble.
see you, brother. Where you start a lot of things, and you're gifted, and there's a certain level of brilliance that you're incredibly capable, but it's like, what do you focus on and go deep in? Because if there's not walls, you can go all over the place.
And then, my wife will tell you, I mean, there's always some, and I have to really, really rein myself in to, um, lately I've been studying stoicism a lot, and I've tried to tell myself, I don't want to be a dabbler. I want to be a master.
Mm.
And I'm trying to really focus on some very specific things. That doesn't mean I can't be intellectually curious and dabble in things, but the majority of my time, both professionally and privately, are centered around trying to master some things that I really, really, truly love.
Now, on the frontiers of dentistry, is there anything on the technology side that is interesting you?
Oh, well, yes, yes, especially with uh, full arch dentistry. There's, you know, 3D printing software, things like Exocad, and that just do all these wonderful, wonderful things, from planning exactly where an implant is going to be placed with a surgical guide, to designing a smile that a patient can see, before you anything. So it's wonderful for someone like me who loves, the arts. That aspect of it is just fascinating.
So is it fair to say that some comfort dental practices could be more bread and butter, and yet your comfort dental practice, instead of having to refer for certain procedures, you can actually do them in house. Now, is that obvious from the sign outside? Like, meaning, is that something that maybe a patient doesn't know when they come in your practice?
That Yeah, and that's something that is a focus of mine, to not only let our patients know, but the other covered dentals, that, you do not have to refer these patients somewhere else. That I love doing this type of work, and I would love to collaborate with you if you have the desire to want to learn some of this. I would love to help you do that. And I'm at that age and that stage of my career where mentoring is appealing.
Tell me, like, what do you love most about what you get to do every single day?
Really think ultimately I'm circling back to alleviating suffering, making the world a little bit better.
You know, what's interesting is that you mentioned the Da Vinci Curse. You mentioned some of the areas where, again, maybe there's a longer runway of you pursuing something, getting mastery in, and yet there's something about dentistry that's got to be so gratifying because it's problem right now and solution in a few hours. Like there's something about that open and closed loop that happens in a visit, or could happen in a visit, or at least in a relatively short time, that must be fulfilling for you because there's so many other pursuits you have that could just be open loops, and you open this loop and you open this loop, and and there's not seemingly an end, but there's something that can be very concrete about dentistry that must be gratifying because you are daily accomplishing something that is very practical. It's very concrete.
Yeah. I mean, sometimes patients are very emotional, and had patients give me a hug after extraction, and I've had them give me a hug after spending thousands of dollars on a full arch dentistry, and big burly guys. So, you know, either both of those things offer me the same reward. And it's very gratifying to do both of those things.
What do you feel like are maybe some of the common things that a new patient might say during a visit or after a visit that and this might be hard just because you kind of hear it all the time that it doesn't stand out as something different. But I don't know, just what are some of the remarks that you hear from new patients?
A lot of times they're embarrassed. They feel like, oh, it's really bad in there, doc. Trust me, it's not. Yeah, I've seen it all. So it's not as bad as you think. Often they are surprised at how fast we can accomplish something. Oh, that's it. That's it. Come see me in 4 months or 6 months. So those are two pretty common reactions. But
Yeah, and I'm sure the first one It's because often, people are avoiding going to the dentist, or you don't know how long it's been. So there's some aspect of like, right, they feel a little ashamed, like, I'm sorry, I probably haven't been doing a good job.
And what I often tell them at that point is, listen, I'm not I'm not here to make judgments. I'm here to try and help. So don't worry about where you're at. Let's try and find a way to help you forward.
Yeah, I think that's amazing. Um, it just seems like Comfort Dental does such a good job making it so that regardless of where people are at, if they're experiencing pain or if they're experiencing suffering, um, it seems like a Comfort Dental practice is the best place for them to show up and come and get taken care of, and to know that they are in good hands. Can you tell me a little bit about your specific practice, maybe, and a little bit about the culture of your team?
Sure. Um, Myself and my partner, Jack Moss. Jack happens to be a musician as well, so I think we both kind of mesh very well in that regard. We try and keep things very casual with our team. I have expectations, but I also allow them a lot of latitude to express themselves and develop relationships with the patients as well. I don't want them to be so paralyzed and afraid to say something that, they're going to get reprimanded or something like that. So we want them to feel comfortable coming in for anything that they want, from an emergency to just a simple filling to a crown to things that I do, the implant side of it. We offer just about anything you can imagine mentally in our practice.
Now, is that something that you and your partner, do you ever play music together?
Yes. Yeah, we have. As a matter of fact, we've performed at an event, Comfort Dental event together. We provided some entertainment, tried to keep it, lighthearted, and did a little entertaining in that regard. So yes, we have.
Has that ever been something you've like held some sort of event in the community as kind of like a music outreach dentistry?
No, I haven't done that, but if it involves playing my guitar or singing or whatever, I'm all for it.
So how many of your patients do you think know that you have this skill or this ability?
Well, not too many. I mean, I think as I get to know them, it probably comes out at some point. But I would say Comfort Dental, we're very focused on, okay, let's maximize the time that you're here. Let's focus on those three things I mentioned earlier. How much is it going to cost? How long will it take? And is it going to hurt? So if it evolves from there into a comfort level where we can, have a conversation, sure, we definitely can allow that.
Okay, so doctor, what is one thing that you wish every patient understood about taking care of their teeth?
Would encourage them to really pay attention to problems, pain in the early stages before they become more serious. It's very natural to be afraid and scared, but I think they should really realize that if they come in before it really becomes severe, there are the options that we can offer them are usually quite a bit.
Is there anything on the connection side between oral health and overall health that you feel like most patients don't know about or don't understand?
Sure, sure. I mean, there's hundreds of studies that show direct links between oral health and systemic health. Everything from diabetes to heart disease, high blood pressure, they're all closely related to oral health. So it's kind of the first place where health occurs. It's where food enters our body. So healthy teeth and gums are the beginning of a process that becomes systemic very, very quickly.
Do you feel like there's any misconceptions or common ones that the patients have about just dental care?
Mm. Seem to be always searching for something more complicated than it really is. They'll come in, oh, I got this fancy new thing. It's like, what? Are you flossing? No, no, not really. It's like, well, it's really simple. If you just floss, it's going to cause, prevent vast majority of the problem you could develop.
So they give you all this like context and backstory as if it's like really complicated and you kind of just simplify it.
Yeah, I try to, but you don't want to, belittle them either. You want them to feel validated by doing research and taking an interest in their oral hygiene. But at the same time, you want to kind of come back to that the basics, brushing and flossing especially, go a really long way towards keeping things healthy.
Is there a specific patient story that stands out to you? Um, that I don't know, that just kind of has stuck with you as like, wow, this is part of the reason I do dentistry.
Um, I'll offer a recent story. I was referred a patient by a good friend of mine um, for a full arch case, and he's a carpenter, and he was suffering. His teeth were broken down, and he's a young guy. He's in his 40s, and you know, but he was ready to do something, and he was embarrassed and he was in pain. So we went through and we did the surgery. And when we were done, I mentioned this earlier in the interview, he took one look at what we were able to put in there. And, he just gave me the biggest hug, this big, burly, carpenter, just gave me the biggest hug. And it was the most gratifying feeling in the world.
Yeah, I mean, that must be just a little surprising because everyone responds differently and you don't know how they're going to express their gratitude. I think some people, even like a lot of people don't like receiving gifts, for example, because they don't want to feel like they have to give a response in front of someone. Um, and some people, it's like the more happy they are, sometimes the quieter they are because they're almost so shocked that they
Yeah.
don't know how to process it. It's almost like a too good to be true. So
Yeah.
I'm sure you've seen every sort of reaction, and yet, from this carpenter to get a hug, it was probably just like, okay, like that must be so gratifying, though.
It certainly was. It certainly was.
Um, in terms of like you driving home at the end of a long day, what is it that gets you to be like, that was just a great day in the op? Is it getting to solve a complex problem? I know you've said twice now that it's just getting people out of suffering. Is that because so many of the patients that come in, like they're in pain and they have a problem and they're looking for a solution?
Sure. Sure. That is very important. I think it's hard for dentists to remember that at the end of the day. You might see 20 patients and one of them was crabby or brought issues from their own personal life into the operatory. And it's really, really easy to focus on that rather than the 19 other patients who were smiling and happy and satisfied with every aspect of what you did. And I think it takes a lot of personal introspection to try and develop the ability to realize that what we do and what you do matters.
So doctor, if a patient like right now is listening and they're thinking about scheduling their first appointment, what would you say to them?
Please come, whatever it is you need. We have the ability and the desire to help you.
Okay, so if you could boil down like one single thing, what's your favorite thing about your team?
They're very lighthearted. They're
So
fun.
that's kind of like the culture. It's not really like heavy and moody. It's just kind of more light and
They're fun. I like when they laugh. A couple of them have very distinctive laughs, and and I like when the office is filled with that.
so what's one word that your patients would use to describe you?
Mm, gosh. Um, Compassionate, I hope.
Um, and then just kind of as we're wrapping this up, finish this sentence. Every patient deserves.
Dignity.
Uh, I think it's been very interesting, doctor, hearing about you and your practice because a lot of the doctors that I end up talking to, they do more of the bread and butter dentistry, and there's nothing wrong with that. There's so much of that to be done. Um, they're making an impact with patients. Again, it seems like every comfort dental practice I hear about has this amazing culture that's always a little unique, a little different, but it's always centered on just giving patients the best. And yet your practice isn't simply just the bread and butter. It now offers all these other services that are above and beyond. Simply because you've followed your gift. The gift that you were allowed to give dentistry is that you weren't content just with this. It's like you wanted to go deeper and you wanted to try this and try that. And I'm excited to see with AI and some of the technologies coming up, the ways in which you will get to figure that out, utilize them, and master them. Um, it's just a very exciting time, I think, to be a dentist.
It really is.
Um, and ultimately, I love that everything has come down to like what you said. It's patients first, and it's getting them out of suffering. Thank you so much just for your time. It has been an honor, and I just want to say like thank you so much for letting me interview you today.
I greatly appreciate it. It was an honor to be asked to do this.
Thank you for listening. You can learn more about Comfort Dental at comfortdental.com.